And welcome to another edition of South Texas Crossfire. This is attorney Joe Flores reminding you to join us each and every week right here on KTMB with the Lopez family. Special thanks to Don Humberto Lozano Lopez. He passed away in 2011, but he is honored, he's venerated, and he's never forgotten. And my good friend Carlos Lopez, you guessed it, the Ted Turner of South Texas Broadcasting. With me today, I have some very important guests, and this is going to be none other than the Texas A&M Health Center right here. Services that are offered to people in a disease, and we're going to be focusing on that, another disease sequelae, and you'll find out what that fancy word means, and complications that happen because of diabetes. So grab your popcorn and sodas, diet and low-cal, and gather round, because this information is going to rock your world, it's going to save lives, and it's going to prevent complications such as blindness and amputations and things like that. As a nurse practitioner, I'm honored to bring on these people, and I want them to introduce themselves to all our 100,000 subscribers strong. Good morning, everybody. How are you all?
Very well, thank you. Good morning.
Ladies first, your name and tell the camera, please.
My name is Veronica Ford, and I am a registered nurse.
And Veronica, did you grow up around here?
I've been here in Corpus Christi for about 28 years.
Wow. And how about yourself, sir? I hear that you are a teacher of these classes. Your name?
I am. My name is David Leal. I'm a health educator and nutritionist.
Well, excellent. And you all are with Texas A&M Health Science Center.
Correct. The Coastal Bend Health Education Center, our local branch of the A&M Health Science Center.
Tell us a little bit about the organization. David, if you want to lead in, tell us a little bit about how the organization más o menos empezó, y también vamos a estar hablando en nuestro idioma porque tenemos también mensaje también controlado con su diabetes, aquí dice el mensaje, y también podemos dar esos mensajes también en nuestro idioma. So tell us a little bit about how it started. ¿Cómo empezó?
The Coastal Bend Health Education Center started in the year 2000 with a diabetes education program and medication assistance program.
Well, and let me ask you, as a registered nurse, how long have you been with this center?
I've been with the center about 2.5 years.
And what are your duties day to day as an RN?
As an RN, I am a health educator. We conduct classes in English and in Spanish. We also do insulin starts. We also do counseling for renal disease. We also do counseling for cholesterol as well. We also do reinforcement of education if they have a new medication with diabetes, if they're starting a new medication that they're not too familiar with. So we'll give them the side effects or how the medication works so they can better understand how it's going to work in their body.
Well, and I'm pre-diabetic, so a lot of you guys who have metabolic syndrome, we're trying to do something out there. So a lot of the time, this center is non-judgmental. You know, when you go out into these offices, people who mean well, you don't ever want to return back because you feel like a 7-year-old that got lectured to. This is a very open program. I've talked to people from over there, so there's nothing to be afraid of to go over there and take these classes, and we're going to talk about the classes out there. So let's start with the classes. You said that you do some classes. Walk us through a typical class, just sort of like a general broad picture. What goes on at these classes?
Well, actually, before the class even begins, we'll do a small finger stick on a patient, and we'll get their glucose as it stands that morning or in the evening for the evening classes. We'll also do the hemoglobin A1C test, and we'll get that result in about 6 minutes. We'll check the patient's blood pressure. We'll check the patient's weight also. That's going to be helpful in creating their personalized individual meal plan. Based on that patient's height, weight, age, and activity level, we'll be able to tell them kind of how much food and how much carbohydrate is really appropriate for them.
And these classes, now I see that some classes are on, están los clases también en martes. Are those for Spanish speaking only or for everybody?
El primer martes de cada mes tenemos la clase en español.
Bueno, entonces, apunta esto. El primer martes de cada mes tenemos clases para la gente que habla nuestro idioma español, y esa clase corre de las 8 de la mañana hasta las 5 de la tarde, ¿no?
Sí, claro. Y si no podemos atender la clase completamente, acabar la clase entero. Podemos venir la primera parte de la mañana y luego regresar cuando podemos terminar la clase.
Y también para nuestro idioma, la gente que habla nuestro idioma español, ojalá que vamos a tener clases también en Robestan en el futuro. Pero también necesito hacerles unas preguntas en español directamente. Las clases, ya cuando verifiquen el azúcar, el peso, todo eso antes de las clases. ¿Cómo corren las clases? And then we'll do it in English.
Empezamos aprendiendo qué es diabetes, qué está pasando en nuestro cuerpo, en nuestro organismo, que es diferente que normal. Luego hablamos mucho sobre la dieta, mucho sobre la comida, para que aprendamos bien qué puedo comer. Ojalá que aprendamos que no hay comidas que queremos evitar o limitar completamente. Sí hay unas recomendaciones mejor que podemos limitar unas ciertas comidas. Luego hablamos sobre las medicinas. Luego, ¿qué podemos hacer cuando las azúcares están corriendo alto o altísimo? Y qué debemos hacer si las azúcares están bajando demasiado.
Well, yeah, and you've heard it there. I mean, the classes are not, you shouldn't, like most foods, you don't have to cut out. It's just the portion and what you can have. The medications that you're taking are reviewed. And some people don't have medications or never have taken them in life or aren't pill takers, So they start out with meds and things. But a lot of people have this idea that a fatalism, I'm Hispanic, I'm overweight, I'm going to get diabetes. There's nothing I can do about it. I mean,
You've mentioned several factors, being Hispanic, being from this area, that we can't do something about. Those are part of our life. We can try to do something about being overweight or obese. There is a potential to lose weight, and that is likely going to be helpful.
Well, you've got people that, the worrisome part that I have is a lot of people are losing limbs, going on dialysis. We're like leading the nation in that. Amputations and blindness is part of what you all do. And the question to you as a registered nurse, do you all do eye checks as well? And to see about end target damage, the eyes are the window to the soul. So do you have an ophthalmologist come in?
No, we don't, but we do recommend our clients who do come in, or patients who do come in, we do recommend that they do see their eye doctor every year, making sure they're staying up with their eye doctor, and also to making sure they get yearly exams, especially if they have pre-diabetes. If they have diabetes, making sure that they go in and get every 6 months, their checkup of A1C. But no, we don't have someone come in and actually check the eyes.
Well, ladies and gentlemen out there, if you don't have an eye care specialist, you need one. And whether you think you're feeling healthy or not, go get your eyes checked. You will be amazed about what you find. Many people already in their middle age, you're finding arcus senilis, where you're showing cholesterol deposits in your eyes. You're looking at arterial venous nicking that's showing if you're having some problems. You can even find out if you have a detached retina already. It's so important to get your eyes checked. So please, the other issue I wanted to talk about was your diabetic education events. I'm very excited. I hate to date my programs, but I know that there are some events coming up here in the spring, and they won't stop. We're going to play this all summer, but these events, now that it's playing in the spring, March 31st is Feeling Blue with Diabetes. And the way we met, your organization and I, is my wife and I wanted the commissioners to recognize World Diabetes Awareness. Then we found out, or really were reminded about your wonderful program. And that was from Dr. Castro, my friend Dr. Elizabeth Leal, and STAR. We'll talk about STAR in a minute. I'm going to give you a plug. But the wonderful people that work there. So let's talk about the family night. We got about 2 minutes left before the break. But let's talk about March 31st. What's Feeling Blue with Diabetes?
We're going to have, I believe, a licensed professional counselor come, or Masters of Social Work counselor come speak to whoever wants to attend. These events are open to the public and they're free of charge. You don't have to be one of our
Free.
already existing patients to participate. There are a lot of what we call psychosocial aspects that revolve around diabetes.
Tell me about it.
Already current issues with mental health, depression that is more likely to develop with a diagnosis of diabetes, and certain amounts of stress that come with coping on a day-to-day basis with the disease. We're going to have a counselor come and kind of address those concerns and provide some suggestions on how to do that for our patients and anyone interested.
Now, the other thing is, from a RN standpoint there, you're having a specialist come in to talk about neuropathy. What is neuropathy? I mean, if you want to tell the public, you know, how is that affecting diabetes and why is that important?
Well, with elevated blood sugars, and if it goes untreated for a while, okay, long term, it can affect the circulation to our nerves. And our nerves are like our first defense, our alert system. It lets you know, hey, something's hot, something's going to burn you. Kind of helps you stay away from those things. But with high blood sugars, the circulation is impeded or it doesn't get there enough. And over time, those nerves kind of shrivel and go away. And so that's when the neuropathy sets in, maybe feeling some tingling sensations, maybe some numbness, even pain to the arms and legs, and also feet as well, because it's the furthest away from the heart. So therefore, it's kind of, the circulation is less and poor there. So
I could not have said it better. I think you both are great educators, and I think as one of my great orator and heroes said once, we're talking down to earth in a level that each and every one of us can understand, and that's what's important. And you know, the 10th anniversary of my father's death is today, and complications. The owner of this station had complications from diabetes. We're waging a war to prevent this disease from spreading, and it is a disease, and it's a curable and preventable disease. We're going to take a break, and when we come back, we're going to talk about real life stories and how this organization impacts our community and how you can get involved and how you can help. Maybe even get out your checkbook when we come back. We're back after a brief break. You're watching South Texas Crossfire with Attorney Joe Flores. And we also want to remind you of our sponsors, River City Hospice. Hope, dignity, and love. It's got to be hospice. Sometimes you need that help. 882-5900. Find out what hospice is. And Vasquez Flores Home Health, 881-9922. Don't have any experience in healthcare but want to help others. Give them a call, 881-9922, or if you know of someone who needs help. Nursing homes have their place, but staying at home, there's nothing like it. There's no place like home, like they said in Wizard of Oz. But anyway, we're back, Texas A&M Health Science Center. We're here for the Coastal Bend area of that's helping save lives with their diabetes training. We've got an educational specialist on it, and we've got an RN today. So I am very, very proud to bring these people on, and hopefully we can partner with KTMB and keep the message going. But enough about me. You guys introduce yourselves to the camera once again. Your name, ma'am, and what you do.
my name is Veronica Ford. I'm one of the registered nurses, also health educator there at the Texas A&M.
And you, sir?
My name is David Leal. I'm also a health educator with the program.
Oh. As a registered nurse, I mean, why do you do what you do? You could go work at Baltimore and DC, Houston, you stay here in Corpus. Why do you do what you do as an RN for this particular institution?
First of all, when I started working here, before I started working here, I'm a dialysis nurse as well. Been doing dialysis for about 13 years. So I see what diabetes, uncontrolled diabetes, can do. I don't like to say diabetes causes renal failure. I like to say high or uncontrolled high blood sugars can cause renal insufficiency or renal failure, which is kidney disease.
Yes, ma'am.
And so we've seen in our program a lot of our clients that come in with high A1Cs at over 14, meaning, you know, the running blood sugars in the 400s, 500s, you know, and then they come to our class because, and then about 3 months later, their A1C is back down to 6 or 5 or to normal, because they had no idea that certain things that they were doing in their day-to-day life was causing the increase in blood sugar. And it can be anything. There's different things for everyone. Not everybody's the same. And when we educate you or talk to you, we will individualize that care for you. It's not the same for everybody. And taking those small little steps can make huge differences in your bringing down blood sugars.
And when that happens, look, you mentioned something, the hemoglobin A1C, and I want to stay with that. Mm-hmm. That's a fire raging out of control. That's the way people need to look at it, that a hemoglobin of 14 is danger. Mm-hmm. You bring that down. How do you guys bring that down? That's the key question. People say it's almost hopeless. I check my blood sugars and I'm good if I have 250, right? And you hear that all the time. How do you bring it down to that level?
Well, first of all, I don't bring it down. Neither does David. Neither does Texas A&M. The actual person will bring it down. The person manages diabetes day to day. Not even the doctor manages it. We show you, hey, the doctor gives you certain things for you to do, maybe medication, maybe gives you a lifestyle change, maybe a different diet. Maybe he says, go and lose weight. We show you how. We tell you, maybe we give you a meal plan, show you maybe easy exercises that you can do at home. Maybe we also do physical activity in class. We do about maybe 15 minutes of just physical activity. Sometimes it's just walking in place, doing what you can, and then measure the blood sugar 15 minutes later, and voila, blood sugars came down. Sometimes it's like a big eye-opener. Some people don't realize that just a little bit of physical activity during the day makes a huge difference in blood sugar.
We also provide support and encouragement and are able to answer questions that maybe spring up in a patient's mind. Maybe, do I need to take my medication every day? How often should I take it? How can I administer insulin? These are questions that we're able to provide the answer to and help a patient help themselves.
And the underlying theme I'm hearing here, David, is that you can lead a horse to water, but you can't make him drink. In other words, I think in our culture, and I'm talking about Mexicanos primarily, this is targeted to you, there's a lot of it is an external locus of control idea. That's a fancy college word for en las manos de Dios. Si Dios quiere, okay? Well, God wants you to help yourself too. You have to do it. No one else will do it. As Ms. Ford said, I don't do it. When I asked that loaded question, how do you lower their blood sugar? That's almost a loaded question saying, I'm not doing it, they're doing it.
Yes, yes. I'm thinking of a patient in particular who came to us maybe last year in a pre-diabetes with a hemoglobin A1C consistent with a diagnosis of pre-diabetes.
John Smith.
And he didn't quite finish the program.
And why? Did that frustrate you? Or?
No, it didn't frustrate me, but perhaps he wasn't quite ready.
Okay, so in this, what you all do, it takes patience. Like you work dialysis, right? You feel you're people at their worst sometimes in diabetes and at their best because that is the end stage sort of deal. A lot of people feel really depressed, like you mentioned, when they're at that. How does it feel to go from when the tertiary complications set in and you're getting to have that opportunity to start at the very beginning?
It feels amazing. You open up their eyes. It's not that you don't want to do it. I don't like to put a blanket on people and say, well, los mexicanos no quieren hacerlo, or the Hispanics doesn't want to do it. It's because they don't know. It's not their fault. It's just they don't know. So when they get there, majority say, wow, I didn't know that this was going on in my body. I didn't know that blood sugars need to be in this range to prevent complications with diabetes. I didn't know what the A1C is. Sí, they tell you it's an average. Sí me dicen que es un promedio, pero ¿qué es ese promedio? Why? How do I get there? Well, on the daily day we say, okay, antes de comida tiene que ser tanto, después de la comida tiene que ser tanto. Y vamos a bajar poco a poco, no rápidamente. Es algo que es por vida. Entonces, como es por vida, poquito a poco vamos a cambiar no todo de la noche a la mañana, sino poquito a poco, para llegar al nivel que queremos y evitar las complicaciones a largo plazo.
And that's well said. The thing is by increments. small. El nivel va poco a poco. No hay nada que pasa un día al otro. También necesitamos a realizar que estas cosas cambian. Como las complicaciones vinieron, así va a ser también a prevenir o evitar las complicaciones de diabetes. So, little increments of things help. You mentioned the exercise, even 15 minutes will help. From your classes, without giving away people's names and things, we have to be so careful, but what is the reward? Same question to you. You could go anywhere you want. You guys are young, you're educated. Why do you stay in Corpus and do what you do?
There's a lot to be done here.
Okay.
There's a lot to be done here. There's a lot of people to help. Diabetes, maybe unlike other chronic diseases, really requires it requires the education. I'm not sure if heart disease or other chronic diseases require the understanding of what's going on inside of your body as much as diabetes does.
Right.
And being able to break it down. I think Einstein said, if you don't understand something, if you can't explain something simply enough, you don't understand it.
Right.
Okay? If you can't explain it simply, you don't understand it well enough. So we need to make this information accessible. There's an internet full of information. Doctors are wonderful, wonderful resources. There's American Diabetes Association, mounds of information. Hopefully we can take the time to just really be able to make sure that patients are understanding what's going on and what are the appropriate ways to help manage this disease.
You know, I always give this because this may be played on radio. I'm a little lost today on the number. It's 561, ringing a bell. 561-8584. If we're on radio right now and I'm playing this, or you're just walking around the house and but hearing me in the background, 561-8584. And I want you to burn that number in your memory, 561-8584. Dave's going to put that up on the screen. And I think it's important that we talk a little bit more. We'll probably go a little bit more with your permission, Dave. We'll do a little bit more here. We're going to take a break, and when we come back, we'll talk a little bit more about the classes and things that you can do at home before you even go over there and get checked and go to a class, because maybe you will or maybe you won't. You're not ready, but you're ready to do something at home. So when we come back, we're going to talk about that, little baby steps, when we come back. And we're back after a brief break. You're watching South Texas Crossfire with Attorney Joe Flores. We're here with the Coastal Bend, the Texas A&M Health Science Center. We're talking about diabetes. And if you've just joined us, it's not too late to, and we're going to be playing this again and again. We were talking about diabetes. The main things, the themes here are that you're in control. They have the information there that's going to give you information that you can use right now while you're watching us on TV. You can use this information. A guy like me who's overweight and stuff, I'm the typical guy. I'm the walking poster, you know, to prevent things. So they are inspiring me as well. So we're here with Miss Ford. And could you tell the audience your name and title once more?
Yes, of course. My name is David Leal, and I'm a health educator with the Coastal Bend Health Education Center.
And Miss Ford, you're an RN.
Yes.
All right. And your first name again?
Veronica.
Remember Veronica Ford. Okay, David Leal. And remember the magic number, the 561 number, and that's 8584. 561-8584. So we have the center. We have the pre-screening. We have the education. What about the guy and gal at home that said, I'm probably never going to go over there? How can we help them right now, even if they don't set foot? And I'm telling you, you need to go over there and set up 561-8584. But say you never do. How can we help these people that may not step outside the house or can't? What can they do right now to prevent diabetes or get checked? What can they do on their own when they go to the drugstore? What can they do right now?
We would encourage people to have regular, at least annual visits with their physician or a physician. With regard to some of the more everyday things, talking about food, Remember, it's not just food, it's also any liquids that we consume also. It's been recommended by the American Diabetes Association to strongly limit or avoid beverages containing sugar.
Bud Light, I mean, and barbecue, let's talk about it, you know, every weekend, right?
So that
Can you have a beer if you're a diabetic?
Yes, you can. That every weekend is probably the most, the biggest part of that statement that needs to be examined.
Right.
It's every weekend.
Yes.
And
sometimes.
Right. Well, there's always events that happen. You know, I'm not concerned about that barbecue every once a month, once every 2 months. But if we need to take a closer look at what we're doing every day. Right. What are we doing with any kind of regularity? And it doesn't have to be every day. There's going out to eat, sometimes only weekly by certain families. That can affect our blood sugar. Certainly, and then going to a more frequent, like more than 1 or 2 or 3 regular sodas, or consuming juice daily. Any beverage that contains sugar, is avoiding that is going to be very helpful.
And from an RN standpoint, if somebody said, well, I'm not going to go to your class, and I'll probably never see you in person, but I'll take away what I get from what you give me today on the TV, and I'll do something at home. If you had that type of person, and you've met that type of person, you've dealt with thousands of people in clinic, what would you tell them?
I will tell them that diabetes is a serious disease, and it's very silent. You're not going to feel nothing probably for a long period of time. Blood sugars can run very, very high without you even knowing it, okay? And once certain complications arise, that's when you feel it. So you don't want to get there. Okay, how do I do that? Well, first of all, if you're definitely over the age of 20, go to the doctor. Get a screening every year. Just go. Even though you feel fine, just get your baseline. Know what your numbers are. Therefore, you can compare them every year. Are they going up or are they coming down? Okay. The doctor can definitely counsel with you and let you know, hey, this is what you need to do, because he better knows you. And then we're here to just kind of reinforce. We're not the doctors. We're not the ones who give medical advice. We're here to kind of spend that time and kind of explain what the doctor has given to you. Okay, you don't want to come in, that's fine. You can call us as well. We're here. Again, that number, 561-8584.
Magic number.
Yes, give us a call. We're there to answer questions on diabetes. And hopefully starting that conversation, just being aware of your risk factors. Does it run in my family? Does mom, dad, my sister, my brother, do they have diabetes? Just take it serious. This is pretty much what it is. And can something be done? Yes, it's proven and it's been researched that if you do lower the blood sugars with time, the complications will either develop slower or even stop from developing, or even developing diabetes type 2 in general. So, I mean, there's a lot of hope out there. We definitely like to inspire people and that you can do it. And don't be afraid. A lot of people are afraid. Just get the conversation started with the family. Let's get together and let's talk about this. There's no magic thing that you have to do, but yes, being more aware, like David said, it's those sugary beverages. Maybe we're consuming too much, again, maybe talking to a nutritionist or somebody who is definitely knows nutrition, dietitian, things like that. If they're within reach, sometimes they are. Health fairs, those are awesome to go to. Go in and see what your numbers are. They kind of give you parameters. You're normal, you're a little bit high, things like that. Pay attention to those. I'm a little high, that's just kind of red flags for you. And just don't sit back and do nothing, because sugars will rise if you do nothing, regardless.
What about exercise? If they're at home, what if they're at home and they don't come see you? What would you tell them to do at home right now?
Right now, get up and move.
And do what?
Get up and move.
Just actually get up and move. Just move. It doesn't have to be, gym type activity.
5K runs.
No, that's great. That's great. We would recommend kind of building up to that if we're just
But even, what does a little exercise do?
Walk.
We can see 15 minutes, we've seen in class, this is anecdotal, you know, just from seeing it in class, 15 minutes of exercise has dropped blood sugars by as much as 150 points.
15 minutes, and that's like walking around the block.
It's the marching in place, actually.
Marching in place, you don't even have to leave your door.
Yes, you can stay in the air condition, you can stay out of the rain or stay out of the cold, you can march in place. You might perspire just a bit. Of course, keep in mind any limitations to mobility or balance you might have, so make accommodations for that. Hold on to something, hold on to a table with one hand. But yes, just marching in place. As I move my feet underneath the table, just marching in place. We regularly see blood glucose, because we check blood sugar before the exercise. Do a 15-minute march in place, and then check the blood sugar after. We routinely see decreases in blood glucose by 40, 50 points.
I don't want to stick myself. I hate needles, right? Everybody says that. I don't want to be one of those people tethered and sticking. What advances have they done in the finger sticks that have made it less painful?
A very, very small amount of blood is needed for all of the devices to work. I think it's 0.03 milliliters of blood is what's required for those to take for a blood sample, for a glucometer or blood sugar meter to work. The needles have gotten smaller, they've gotten thinner. It's not an intramuscular injection like the flu shot. It's just a stick. It's just a small stick. And there are other diseases and chronic conditions in which people have to have bigger injections or blood taken. This is not that kind of thing. It's a small finger stick, and if there's special situations that make that extra painful, we can try to help work on that.
We probably have about 30 seconds left. What do you want? And I always like to leave on a high note. I want to thank you both for coming on. What would you like to tell the public? Your 30 seconds, boom, closing arguments.
Complications are not inevitable. They are very much preventable with basic care and basic questions and taking care of yourself. And we can answer a lot of those questions. I don't want to say all of them, but a lot of them.
651-8584. Ms. Ford, what would you like to tell those people? Obviously, you both care very much about what you do and the people that come see you.
I would like to tell them that little steps, big rewards. Pasos pequeños, recompensas grandes.
Her Spanish is great, isn't it? You know, and that's what we need more of, Spanish in South Texas. So Spanish is so important too. Even though most of us born after 1930 are speaking more and more English, it's important to have that Spanish aspect because of the culture. You know, a lot of the time people, don't be afraid to go to your physician or come to these classes, because it's going to be non-judgmental. For the first time in your life, somebody's not going to say, you did this and it's your fault and you're bad. And that is the system that has been around since I was an RN. Very judgmental. We have people not of this culture that will slap somebody on the hand and reprimand them, and then they say, well, I'm never going to go back to that person. That's a diabetic educator? No, that's a diabetic judgment lecturer, you know. And I hear that again. When I go out to people's homes and say this, and I still do house call visits as a nurse practitioner, and I'll go out and people said I never went back because they made me feel less than. Or the home health nurse who came in, looked in my refrigerator and said, no wonder you're overweight, no wonder you have diabetes, look at this. And people, healthcare professionals out there, you need to learn too, to be very culturally sensitive, and when in doubt, 2 ears, 1 mouth. Listen to what they have to say. You know, and that's the thing about healthcare educators and everybody out there. You want to reach these people, you got to learn how they tick. And like you said, you're putting the ball in their court, but in a way where, hey, I bet you most people out there didn't know if you walked 15 minutes, your blood sugar level could drop 50 milligrams per deciliter. To 100. And last but not least, can you guys come on again so we can have another talk?
Yes, absolutely.
Sure, this is wonderful.
You guys broke the whole camera shyness. You guys own it. You're better looking than me. I think we ought to launch a show. Dave, what do you think? Okay. We're out of time, but if you have any other questions, 561-8584, 561-8584. And if you have a handheld device, what's a good website for them to go to? I don't know. Is there
That
one?
would be cbhec.tamhsc.edu.
Wow. Okay. We're going to put that up on the screen nice and slow for everybody because, you know, it sounds like we're auctioning off cattle with that one. So it's cbhec.tamhsc.LMNOP.MICKEYMOUSE. So that's going to be on the screen so you guys can get it with the phone number. And you can always call me. I'm going to have this tattooed on my forehead and on the wall because I'm trying along with you guys. Let's do it together.
You can find us on Facebook and Instagram also.
Esto la onda. Facebook. Now we're talking. Okay, on Facebook, what are you guys so we can friend and like you?
Coastal Bend Health Education Center.
Esto. Coastal Bend Education Center.
Coastal Bend Health Education Center.
Coastal Bend Health Education Center. Facebook. Them. Like them. I'm going to do it right now on my phone. It's as easy as that. Small increments. I want to thank you all both for coming on. And you're going to show a picture of your brother to see how much we look alike.
Yes,
Maybe we'll
I
go out for one beer and one pork rind. Okay? All right. And we're out of time. Thank you guys, and God bless.